Good afternoon. My name is Lenx Smith, and I happen to be one of the patients in this state in the medical program that's been in existence since 2006. As we talk about the idea of legalization in the state, RIPAC, which is I'm on the board for, and my husband is also, stands for the medical patients and the safety of medicine to all people and access. So we've had to really look over what would it mean to the medical program to allow a legalization. And the bottom line is we've concluded that it would actually help, and I'd like to share some of those examples of how it would help the medical program also. One concern we had was what would happen if a medical patient went to the compassion center and we had full legalization, and all of a sudden all the medicine was sold instead to people for socialization instead of the medical people. Now, the nice thing I can announce is that there is an amendment that's been added. The sponsors of the bills have agreed to add this amendment that would ensure that the medical patients would remain the priority first, and that if they do not do that, their licenses will be in jeopardy. So we're thrilled with that. We also found that this would have absolutely no effect on our grow rights and appointing caregivers, so that's another plus for us. There are many times a medical patient suddenly, without planning, ends up in the hospital, and once you know, the card was supposed to be renewed, and the next thing you know, they come out and they do not have a legal card to enter to the compassion center and get the medicine they need. Full legalization would mean if that happened to somebody, they would still have the right to go into that center and get their medicine and not go backwards on taking care of their health. So that's another plus. There's also the circumstance in our state that there's still some people that are not finding with their medical conditions are qualifying. But what they're able to do with full legalization is try medical marijuana, see if it makes a difference, and then be able to return to their doctor and say, look, I legally tried it, it is working, now please help me get into the medical aspect of this program. Those of us in the medical program, most people are not like me and my husband that are out there and people know who we are. Most people are very private and do not want to be outed. They don't want to have people know that they exist, that they're in the program, and they might be personally growing at home or purchasing, bringing it home. And as you all know, we're targets of theft. This, if we legalize for everybody, it equals everything out, and we will not be the target that we have been in the state since 2006. That will help us. And unlike prescription medication, we are paying taxes on our cannabis for sales tax, plant tax fees now, registration fees, and so on. It's totally unconscionable that people who are sick have to pay the state these taxes. Non-medical people are willing to pay taxes, so let's start unburdening the patients in this state. I thank you very much. I hope this comes to a vote, and as we now see, this clearly is going to help all the medical patients in this state to go to full legalization. So thank you. Take care.